Hello and welcome back to Talking Faces. I'm Dr. Raul Cetto and I'm joined today, as always, by my co-host, Dr. Lee Walker. And we're also joined by the lovely Dr. Toni Burke.
Hello, thank you.
Thanks very much for joining us today. And today we're in our Irish studios of Kilkenny. Did I get that correctly?
Yep, Kilkenny.
Yeah. And we will be talking about trends in aesthetics. So I feel we're in a sort of new era of human evolution, possibly, where we start to see people change their looks and their appearance and look differently. Now, is this based on trends? What do you think, guys?
Are we talking strictly body modification? Because that's happened since the dawn of time. I think that humans has always want to adorn themselves or make themselves look more attractive or different. Through sort of, I don't know, genetic selection, really. So I think we really need to pin it down on what we term as the trends. And I think, is it aesthetic trends, or is it beauty trends, or is it fashion trends? Toni, you're well,
I think
better than me.
When I started in aesthetics and I look back, and the main emphasis would be on correcting a line, perhaps, or for people wanting to have some anti-aging treatment, or just generally looking well. And now when we look at those patients who are walking through, they don't just want to look well, they want to look slightly different, slightly more beautiful. Often it's things they see mainly on social media, but it could be a celebrity, it could be a blogger. And they want to change quite a few things on their face. And you could say, well, it's just a natural enhancement of what they have. And some people might say that's acceptable. But I think it goes beyond that. I think some people are actually wanting to look more like what they see. You know, they're trying to change their beauty. So it's moving away from all our individual beauty and moving towards certain standards of beauty. And the question is who's creating the standard? What is the standard? Should we have standards?
That's a really interesting one. And I mean, do you think these standards or these trends, do you think they come from media, from celebrities, etc., or what were you guys doing back in the Middle Ages, Lee?
Well, there was nothing about beautification because social media then was sort of embryological. It really hadn't started. So I think if we go back to sort of when I started, it was about, like Toni said, it was about correcting a line or a wrinkle, something which they felt had appeared and they wanted eradicated. I don't think there was any sort of request for moving away from a typical norm. I think it was just treat this part of the aging process which I'm concerned about. So we were treating lines and wrinkles in isolation, but now it's completely changed.
Right? I think now you get patients with a picture of someone else's lips and they're like, I want these lips, right?
Yeah.
And but what do you do when that happens?
Yeah, that's a good question. I think to a certain extent, lip fillers have always been relatively popular, and particularly in those from the younger generation. And so most of us are quite comfortable to add some lip filler to those patients. The question is, how much lip filler are we adding? And if they show us a picture of particular lips in a certain fashion, do we try to aim for this? And I think most of us will probably, tell the patient, well, we're not going to make it exactly like this. However, we might be able to do this for you. But it's a question of, when do we stop? How much do we give? Do we add more?
I think this is one of those points within our career that we say we're going to have to take the whole face into consideration here, because I think what we've done for too long is done treatment in isolation. So we treated one anatomical area and then left it because that was being the patient's request. I think what we need to do also is also factor in the patient's age. Are we doing things which are age appropriate? And are we treating things solely in isolation, or is it more of the holistic approach to the whole face? Because I think that's where we're getting skewed away from the norm, is this treatment in isolation. So we're having bolt-ons of different people's looks onto this face. Yeah. So we're moving away from it.
Well, I think when we started out, we were very good at treatments in isolation. If you going back before this advent of sort of social media boom, we were quite good at just fixing this and just fixing this, but most practitioners now really do try to look a little more holistically in treating everything, but maybe we're not good enough at it as well.
Well, like I have discussions with Raul pretty much all the time, and I think it was our lack of knowledge. I didn't think we knew the aging process well enough. I didn't think that we knew anatomy well enough, or the tools at our disposal, the rheology of the fillers that we had. You know, we didn't know how to use them properly. So for us, I think producing some of these results was because of our lack of knowledge base, and even anatomy now. So the transverse facial septum, this septum that really displaces the fat pads further north and causing this big apple cheek that we see now. We didn't know that existed until last year. So again, looking at these things, then we can hopefully get back to what we call the norm. And I think I read a quote somewhere about beauty. Beauty is averageness. If you're beautiful, everything is in average. So it's a quest, I think, for averageness and not for this over-treated, over-filled appearance that we're tending to see.
You're very average, definitely, Lee. Now, I'm going to play a little bit of what you like to do, playing devil's advocate. Now, okay, at the moment, we're seeing trends, and these trends, they change depending on what social media is showing. You know, might be lips, might be jawline. I think we're getting that a lot, right? But they're based on other people. They come to us with a photograph, and they're like, I want this jawline, I want these lips, I want these cheeks, etc., right? So it's our job to sort of take a step back and assess the full face and explain and educate the patient what would suit their face. But what if these trends start to change? And what if people are not just looking at trends and features that they see in other people, but in, I don't know, something that they might see in a film or in some sort of cartoon character, like the whole bagel forehead that we used to see? What if it gets to that? Like, what do you think it could get like that? People started to ask for that, horns, something like that?
Well, I think one of the reasons people have caught on to these trends is because people look upon fillers as being semi-permanent. Well, they're not going to last particularly long, so they're assuming that, say, 1-2 years down the line, this isn't going to exist anymore.
Yeah.
So, you know, if they want a bagel on their head, well, why does it matter? It's not going to last forever. When I'm 50, it's not going to matter.
Yeah.
But that brings in the question, are the trends dangerous? Because do we know enough about the fillers we're using? Do we know enough about our products to know how really long they last? Is there any damage they're causing? What will exactly happen in, say, 2, 5, 10 years' time when they've got this bagel on their head?
I think, Tony, I think what we're going to have a real challenge with, if we starting to almost make a hybrid of the patient, you're going to get what I would term to be an aesthetic, a Mr. Potato Head. You're just going to get little bits stuck on, and you're going to get this caricature of the person that they once were. So I think it really boils down back to us and thinking we need to re-educate our patients on, is this a lifestyle choice or is it a fad? You know, because there's things we can do that, you know, which will wear off a little bit quicker. So we can use a filler with less hyaluronic acid in, lower cross-linked, almost like a try before you buy type of thing, but really educating them on the norms, and trends don't last forever.
Absolutely.
Because, Tony, I think that we discussed this last time, is female patients requesting these male jaws. What, you know, where did that come from?
I'm not even sure they realise they're requesting a male jaw. I just think they want a defined jawline, and it's only afterwards they realise now they've got a widened, squarer jawline.
But do they realise that?
I don't think so.
I think, I think all they can see is just the well-defined jawline.
And when you see the before and after photos, it's always from the side, it's always the sharp jawline, and you rarely see that front profile.
Yeah,
and
the increase in the bigonial width. Yeah.
Because this trend with the jawline, interestingly now, has led to another treatment addition. It's deoxycholic acid into the submental fat, into the fat below the jaw. And again, this is adding another risk to it. You're risking permanent subdermal atrophy. You're risking demyelination of the nerve into these areas. So in this strive for perfection, for the perfect jaw, these trends are now looking from different areas of medicine and say, you know, help me to go that little bit further. So it's becoming more expensive, and it's becoming more dangerous as we go on with these trends. So do we as practitioners, do we need to stop these trends or educate, or what do we need to do? Because what's the next trend?
Yeah, and another point that slightly disappoints me is I don't get the same amount of patient satisfaction. Well, not patient, my own satisfaction. I mean, is my job about my own satisfaction? Because I do think...
Professional satisfaction.
Yes,
yeah.
professional. You know, in the past, you'd be quite happy if you had, say, a 40, 50-year-old lady, they came in and you were able to quickly, with simple treatments, fix what they've been seeing in the mirror every day. But now, you know, you create this perfect, I say perfect, wide and square or jawline for someone, they're happy. I don't feel quite so, you know...
Is your lack of satisfaction, is that due to the fact that when you look through other aesthetic practitioners' social media accounts, all of their work looks perfect. All of it looks like it's this sort of utopia of perfect treatment on perfect patients. And that would render us sometimes to think, I'm not really that good. I feel quite inadequate. I can't produce results like this. Are we being led?
Are we overly critical?
Oh yeah, are we overly critical? And are the patients starting to expect too much based on these images that they're seeing on social media?
Well, definitely patients do, and you can see that when you even just look through reviews of patients from any clinic, and they'll say, oh, the before and afters on their Instagram page looked nothing what I walked out with. It's a complete farce, because it's a little bit like people taking their selfies. They will take, say, 20, 30 selfies, pick the best one, and that's what they'll post. So as soon as we have our before and after photos, not only are they already selected because we have certain patients that have consented, so you'll have the patients you think will agree to it, they're generally okay looking, you think the result might be okay, you'll post those. So it's a very small percentage of the total amount of treatments that we do that are actually online, that can be visible. And then you have to understand that some clinics may even tweak their photos. They might think, well, I don't want to see a little bit of blood here, I'll remove the blood, or, you know, this looks a tiny bit asymmetrical, I'll just clean that up. So what you see there, what you see in reality, as they always compare, they're two different things. So yes, I think patients also, their satisfaction levels are perhaps a little bit lower once they've got the treatment sometimes.
And do you think that those photographs should come with a disclaimer?
Yes,
Something
always.
saying, you know, results may vary, or this has been edited, so there's no needle marks, or no blood, or no redness, or no swelling. Yeah, we should be honest with our patients.
We should do that, Raul, but unfortunately it doesn't happen.
Well, just bring the patient back after 2 weeks and take a photograph then.
Yeah, that would be great, but it
doesn't have to be fresh off the needle, as they say.
Well, that's really because most people are very visual, and what they will see, they'll take that as gospel. I'm going to book in, their results look phenomenal. And there's really no homework that goes into it with that. How many lips or treatments have you done and you've had 0 bleeding, 0 swelling, 0 redness?
0.
Exactly zeros. Okay. Anytime you put the needle through the tissue, you're going to get a tissue response to it. You're going to get bleeding, you're going to get edema, or you're going to get redness, or a combination of all of those things. And we will see these media accounts with nothing onto them. It's almost like a magic wand has been waved over them, and they've created these amazing results.
Who posts their complications?
Nobody will do. And I think that's where these trends are coming from. It's the ideal, it's the perfect of everything. It's these wonderful results, and these wonderful results are normally with a very small amount of filler. Yeah. So I used 1 mil of filler on this patient and they got this result. Wow. And again, that's a one-size-fits-no-one approach, because maybe they did use 1 mil, but what was the patient like before? Yeah. I don't think these patients need restorative or rejuvenation. Little tweaks, beautification is what they need. So it goes back to these trends. I think that a lot of our profession are responsible for creating trends or false ideals, really, when it comes to patients.
False advertising.
False advertising, 100%. So social media, I feel, is the number one culprit for trends.
Yeah, I completely agree. Social media is definitely a culprit. And do you think that the people that are actually promoting these things, because, you know, a lot of these, I don't know what you call them, pseudo-celebrities or whatever they are, that are posting these trends, Some of them, I think, even say, "Oh, I've never had my lips treated," correct? And you sort of see photos of them a few years back, and you're like, "What? This is a lie." So I think that even they should have some form of disclaimer to say that they've had a treatment done if they're promoting that sort of look.
I think it's just as difficult for them as it can be for the general public, because every type of blogger, every type of influencer also has to, or they might feel pressured into following trends. So they fit the bill, so people want to look at what they're trying to sell, to show, to gain viewers, to gain popularity. So we also need to try and help them along the way. We shouldn't, clinics shouldn't be offering them free treatments to come in and then to blog about it and to post about it. Often
Absolutely.
the time it's not treatments that they need.
Yeah.
If your work is that good, and if your before and afters are that good, then you don't need an influencer or a blogger. The line of patients should be around the block, because you're not causing any trauma, redness, your results are perfect on everyone. So I don't understand why influencers and bloggers have to get involved. It's just like this sort of guerrilla marketing, sort of with throwing everything at our sort of patients and bombarding them with images. Now, I'm worried for my own kids. I've got a daughter who's 17, and she feels like she wants to be looking like this person, and she's incredibly beautiful, stunningly beautiful, and she's aspiring to be someone else at 17. Wow,
dangerous.
It's incredibly dangerous. So it'd be interesting to see complication rates in those younger patients as well, because with trends, they're normally the younger generations who are influenced by those, and it'd be interesting to see if we have some statistics or metrics involved in younger patients, and what problems or what complications we're seeing in this cohort of.
Well, something else that'd be interesting to look at would be age groups of patients and how happy they are with how they look. So naturally you'd assume that those patients, the older patients, would need more work, but you may find that actually people are more content with how they are, whereas 17, 18, mid-20s, they're still questioning how they look, they want to change. And we're seeing now there's a big increase in that age group.
I think you've hit the nail on the head there, Toni. Young patients want to change. They want to change themselves.
Yes.
Whereas older people want to look the same, but just slightly fresher.
Yeah, exactly.
Slightly rejuvenated. So I think you've really hit a really nice point in change, and change is not always good, is it? It's one of those.
Especially with those young patients, because you can, by completely modifying their face, even if you're doing it within proportions, you can actually like strip away their identity. I feel if you enhance them like that. I think.
Do you think they're socially or intellectually mature enough at 18 to say, I want this jaw or I want this lip? Because from a consensual issue, they're well within their rights to seek that. So we're obligated to say, I don't think this is for you, because I think the big fear for aesthetic injectors is them going somewhere else and you losing the business.
Yes. Well, the problem is when you say, are they mature out of 18? Where I work, we make them 21. But either way, is somebody at the age of 21 mature enough? There isn't a fixed age. How do we make an age? Where is a cut-off point?
So, going on that, how would you tell a patient that you're not going to treat them because they don't need anything? I think that's a very difficult.
Turning away patients.
Patients.
We don't want to turn away patients, but we want to be ethical, right?
Yeah. How do you turn them out? How do you turn them out of your door? And
well, I don't usually turn them out the door. It's more so I do try to educate them, and it may be just within skincare, it may be prevention, it may be other treatments we offer as opposed to injectable treatments. I seem to see a good trend coming through in skincare and non-invasive treatments, and that's something I really do support. I'm hoping people are trying to switch back a little bit to looking after what they have, looking after their skin. So it's moving them towards that side as opposed to following maybe what they're seeing with injectables.
And that's the trouble with trends, it's a fad, and fads are really an emotive type of treatment. I just want to have it. I just want to have this treatment because I'm going to feel accepted by my peers, or I'm going to be the first one out of my peer group to have it. So again, it's this social status sort of thing with it. One of the things I say, and it's a very useful tip, and you can all use this out there, is that if I'm uncomfortable seeing a patient and I don't want to treat them in terms of dermal fillers or toxin or anything, I just say to them, do you want me to make you look worse? As soon as they say, well, no, and I say, well, that's what I'm going to do. And their next question is, well, what else do you do? And then I do what Toni does. I talk about their investment in their skincare, about SPFs and all of those type of things. So those patients, I feel very uncomfortable treating, because they're going to go home to mum and dad are going to go, who did this? Yeah.
Do you think women are more amenable to trends than men? It's just, if you think about it, how women love fashion, women love to change their makeup, they love their, I think what else we change, but our shoes, our hair,
makeup, yeah.
So maybe we just expect to change our face sometimes.
Well, okay, Toni, so you have the final word on trends now.
Okay, so
what would you say to people?
Well, we all love our trends, we love our fashion, our makeup, our hair, but these things can be disposed of after a month or two. And when it comes to our faces stay with us. And I personally don't think we should have trends in aesthetics.
Those are very wise words from Dr. Toni Burke. Thank you so much for joining us in our Irish studio of Kilkenny. I think that's how you say it. Toni, where can people find you?
At Cosmedocs, 10 Harley Street.
Well, people know where to find me. It's I'm in Liverpool, and Instagram is LeeWalker_Academy. And same on Facebook. And you know where to find this guy. It's the same place.
At Dr. Cetto at Instagram, you can find me. So thank you so much for joining us. Please like if you like the video, if you enjoyed it, subscribe to our channel, and please comment down below what would you like us to cover, if you would like the lovely Toni Burke to come back and have another conversation with us. Thank you so much, and goodbye from Ireland.